Today, we're talking about something that is absolutely key to staying independent as we get older, but it's probably not what you think it is. This isn't about some luxury. Nope. We're talking about the very foundation of your health and mobility, your feet. So, what really is the secret? When you think about staying active, your mind probably jumps to things like heart health, maybe brain games. And yeah, of course, those are super important. But there's a fundamental piece of the puzzle that so many of us overlook. You guessed it. The answer literally starts from the ground up. Your ability to walk, to balance, and just to live without pain, it's all directly tied to the health of your feet. I mean, think about it. They are your connection to the world, and keeping them in good shape is absolutely essential for an active life. And please, don't make the mistake of thinking foot care is just about getting a pedicure. It's so much more than that. Overlooking our feet can have really serious consequences. Poor foot health can mess with your mobility and balance, which then dramatically increases the risk of falls. And we all know that's a major health threat for seniors. And this isn't some rare issue we're talking about. The data is pretty staggering. Roughly 1 in every 4 older adults suffers from foot pain. Just let that sink in. That's millions of people whose independence is being threatened by problems that a lot of the time are actually preventable. Okay, so to really understand why this is such a common problem, we've got to look at what's actually happening to our feet as the years go by. These are just natural changes, but they create new risks that we need to be aware of and, manage. First off, the natural padding in our feet, kind of like the shock absorbers, it starts to wear down. That fatty cushion under your heels and the balls of your feet gets thinner. And at the same time, the skin loses some of its elasticity. This makes it way more fragile and more likely to get painful blisters, cuts, and even infections. And it's not just the skin. Our toenails change too. They often get thicker, harder, and more brittle. Not only does this make them incredibly difficult to trim at home, but it also ups the risk of them growing into the skin, ouch, or developing nasty fungal infections that can be really stubborn to get rid of. Another huge factor is circulation. As we age, the blood flow to our feet can slow down, and this is especially true for people with conditions like diabetes. This is where it gets really serious, because poor circulation can damage nerves, reduce feeling, and turn a tiny little cut into a serious wound that just won't heal. So, all these age-related changes, they lead to a handful of very common, very frustrating conditions. We're talking about painful corns and calluses from all that pressure, bunions that can actually change the shape of your foot, persistent fungal infections like athlete's foot, and of course, those dreaded ingrown toenails. And again, for anyone with diabetes, the risks are even higher, leading to specific foot diseases that need constant, diligent care. But hey, it's not all doom and gloom. Far from it. Being proactive can make a world of difference. In fact, setting up a simple daily routine is probably the single most powerful thing you can do to protect your feet and stop these issues before they even have a chance to start. And what's great about this is just how simple it is. These 4 steps are your first line of defense. Number 1, wash and dry your feet every day. Be extra careful to get the spots between your toes. Number 2, moisturize to stop your skin from getting dry and cracked. But, and this is a big one, skip the area between the toes. That can encourage fungus. 3, do a quick daily inspection. Use a mirror if you have to. Catching a small problem early is everything. And finally, number 4, start thinking of good, supportive shoes as essential equipment, not just an accessory. Now, these daily habits are absolutely crucial, but they aren't always enough. It's just as important to know the signs, the signals that tell you it's time to call in a professional. Ignoring these red flags can turn a small issue into a major health problem. So, how do you know? How do you know when you've hit the limit of what you can handle at home? At what point does a little annoyance become a real red flag that needs a professional's eye? Okay. Here are the big ones to watch for. If you have thick or ingrown nails you just can't manage, or corns that are really painful, or any sore that just won't heal, it's time to get help. Any sign of infection like redness, swelling, or warmth is an immediate red flag. And let me be crystal clear here. If you have diabetes, any foot issue, no matter how small it seems, warrants a call to a professional. Period. So who do you call? Well, you've basically got 2 main types of pros who can help. A podiatrist is a medical doctor who can diagnose and treat more complex conditions. Then you have a foot care nurse who focuses more on routine maintenance and preventative care, things like nail trimming and health assessments. Both of them play a really vital role in keeping you on your feet. For a lot of seniors, just getting to an appointment can be a real hassle. And that's where this amazing, growing service comes in, at-home foot care. It brings the professional right to your front door, which gets rid of a huge barrier to getting consistent care. I love this quote because it really just captures the whole vibe. It's about getting that professional medical grade care, but in a place that feels safe, familiar, and totally comfortable. It really transforms a clinical chore into a relaxing, convenient part of your wellness routine. The benefits here are pretty clear, right? You get to skip the stress of traffic and waiting rooms. You get dedicated one-on-one attention from a nurse who can tailor the care specifically to you. And you get that peace of mind knowing a certified pro is using properly sterilized equipment, all within the safety and comfort of your own home. It's a game changer. So what actually happens during one of these visits? Well, a typical visit is pretty comprehensive. The nurse will start by assessing the overall health of your feet. Then they'll professionally trim and file your nails, gently and safely reduce any corns or calluses, moisturize your skin to keep it healthy, and often they'll finish with a light massage to help boost that all-important circulation. So, after all this, the real question isn't just about what you've learned today, but what are you going to do? What's one step you'll take this week? Maybe it's just starting a daily inspection, or finally buying a better pair of shoes, or maybe it's scheduling that first appointment. Taking just one small step can set you on the path to better mobility and lasting independence. Thanks for tuning in.